Hello everybody, my name is Veronica Kinsler. This is my second video for Caring Matters Now during the lockdown. I'm trying to answer people's questions about congenital melanocytic nevi, about CMN. So again, this time I'm going to talk a little bit generally because we've had quite a lot of questions about the same issues. So rather than repeat all the questions and repeat all the answers, I'm just going to try and give the information about that subject area. We will still try and get to everybody's questions gradually as we work our way through. So again, I'm answering, this is the end of April 2020. The answers would not be the same in the future, so you must understand that these answers are as well as we understand today. So lots of people have written in about laser therapy and the use of laser therapy and whether it works for CMN and whether it works for hair removal. So first of all, in terms of whether it works for CMN itself, we did a big study recently, which had taken many years actually, where we looked at the colour of CMN over time in the same people. So we had a large number of people and we took photographs and recorded the colour with a special colour measurement machine, colour measurement over time, and we looked at what happened to their CMN. And in particular, we looked at people who had had part of their CMN lasered or treated by another type of removal like dermabrasion or curettage. Those are techniques where the top of the CMN is removed, is scraped away. And the bottom is still there, and laser does the same. It takes away the top and leaves the rest. So we were particularly interested in people who had been treated half, so part of it had been treated and the other half hadn't been treated, which often happens. For example, people don't treat in sensitive areas like in the nappy area might not be treated and the other bit would. But the CMN is joined up. So part of the same CMN is treated and part not. And in those cases, what we were able to show is that the laser therapy did not make any difference to the colour in the long run. So in the area that was lasered, there was a temporary lightening, but then the colour of the CMN would come back. The colour was not always as dark as it had been at the beginning, at birth. But when we looked at the bits that were not lasered, they had ended up at exactly the same colour as the lasered bit. So what we realised was that the CMN, eventual colour of the CMN, is actually dictated by your body's own skin colour. So if you're someone with dark skin, a darker skin tone, your CMN will be dark at birth and will probably stay dark. If, however, you're somebody born with lighter skin, then your CMN is often very dark at birth, but it gradually then lightens over time. And that this impression that we previously got from people who'd had laser therapy or the other techniques to remove the top, it looked then that it had made those CMN lighter than they were at birth. But actually that's something that was going to happen anyway. And any of the therapies can give you a bit more temporary lightening, but that it grows back again. So you end up with a CMN, the colour that you are actually programmed inside yourself to be. So people with darker skin tones, darker hair types will have darker CMNs. People with lighter skin tones, lighter hair types will have lighter CMNs eventually. So we don't think it's worth doing any of those treatments for colour. And that is what they're usually done for. What we didn't look at was whether laser therapy made any improvement to the chance of getting lumps or bumps in it or nodules, or whether it increased or decreased the chance of it behaving in a certain way. There is no data on that. We don't have the impression that it would reduce the chance of it becoming malignant. I really don't feel that's likely. But nobody has studied that, so it's not something we can answer for sure. And some people have asked in the questions, would it increase the chance of getting a skin cancer? And again, we hope that that wouldn't be likely, but there is no data on it. So we don't think that laser therapy is a good treatment, or dermabrasion or curettage. Of course, they were done by people thinking they were doing the best thing. We absolutely understand that. But now with the data we have at the moment, we wouldn't recommend it. So in terms of whether laser therapy is useful for hair removal, in general, if anyone, so not somebody necessarily going for a CMN, somebody that wants to have laser hair removal for any reason, it will work better if your skin is light and your hair is dark. So in a CMN, the background colour is usually dark and the hair is dark. So, or the colour is very similar, at least, between the CMN and the hair. And because of that, there's actually a risk that when the laser is applied to the hair, that it will also burn the skin. So it's also going to be lasering the CMN itself, which we don't think is a good idea. So we wouldn't recommend having laser hair removal for CMN. We don't think it would work very well. It is, however, always possible if people are desperate to get opinions to ask a laser hair person about their opinion. And if they wanted to do it, we would strongly suggest just using a small test patch first to see if it was going to work without burning the skin. So that's what we would recommend. Many laser therapists, though, will think that the CMN would be good, that the laser would be good for the whole CMN, that it would be good for the colour, but we know that's definitely not the case. So it's worth remembering that if you do go and see somebody about thinking about the hair. So we don't think it's probably a good treatment for the hair removal, but we do understand that it's a major problem for people with CMN, and if people really want to find out, you could ask a laser hair specialist for an opinion about you. Now, the other question I've had is about nodules. So whether nodules should always be removed. And unfortunately, that's not a question that I can answer on a video like this because it depends. It depends on the person. It depends on the nodule as well. So that is a question that has to be answered on an individual basis by your doctor. So if you have nodules, if you're worried about nodules or lumps, absolutely do ask your doctor to look at them and ask them for an opinion about whether they should be removed or not. But it's not something, unfortunately, that we can say as a blanket rule, yes or no. It has to be looked at on a person-to-person basis. We've also had questions about melanoma risk. So some people have wanted to know whether the chances of getting melanoma are different for people who have different genes. And at the moment, as far as we know, no. There is no difference in the chance of getting melanoma depending on which gene is causing your CMN. We also know that there doesn't seem to be any difference in the chance of having neurological problems, so brain problems, with different genes. That seems to be something that can happen with any of the types of genes. Now again, going forward, as we understand more about the 25% of people where we don't know much about the genes at the moment, that may change. But our understanding at the moment is that you don't need routine gene testing for CMN. It doesn't need to happen routinely because it doesn't change your chance of getting problems with the brain or your chances of getting melanoma. The one time that we would suggest getting, or at least, definitely getting a test for the gene, for either the NRAS or BRAF gene particularly, is if somebody actually develops melanoma or where melanoma is strongly suspected. And the reason that it's worth testing for the gene then is because it changes the type of treatment that you might be given. But actually that is very well known and very well understood by dermatologists and oncologists already. So I think you would automatically be offered that testing if someone thought you had melanoma. So that's usually not too much of a problem, and it is something which is tested in the normal population anyway for melanoma when it arises. So it's usually a test that's available. So I hope that answers some more of the questions, a little bit on laser therapy, a little bit on melanoma, a little bit on whether you need to have gene testing done. And Again, I send you lots of love from London, and all of you, please stay safe. Bye. Till next time. Bye.